Hello there. My name is Jonathan Friedman, and you're listening to 5 FAQs by EHN Canada. This is a show where we scour the internet for the most frequently asked questions about mental health and addiction and ask an expert for their answers to them. Today, it is my honor and my distinct pleasure to welcome Geoff Ingram to the show. Geoff Ingram, a reformed political staffer who left politics to get sober. After attending EHN Edgewood Nanaimo, Geoff discovered a passion for working with individuals suffering from addiction and mental health issues. He has been working at EHN Edgewood Nanaimo for over 5 years as clinical support staff, research assistant, and counselor, and now the National Research and Measurement Based Care Coordinator. At the same time, he completed a BA in psychology with an addiction certificate from Vancouver Island University. Currently, Geoff is attending McGill University working on a Master's of Science in Public Health and hopes to continue serving the addictions community. Geoff, welcome to the show.
Thanks for having me, Jonathan.
How is everything going?
Things are well. Yeah. I mean, there's a lot of addiction news happening right now. A lot of things happening in the world of addiction treatment, and the changing political landscape. So it's an interesting time to be looking at this subject, for sure.
Amazing. Yeah, it's a wildly shifting world, and every time there's new governments in place, everything has a big shift.
Yeah, and even existing governments like in BC that have been kind of harm reduction advocates for a long time are starting to shift into a more abstinence-based treatment model. So,
Very interesting.
yeah, I mean, there's lots of interesting things happening.
So today we're actually going to be diving really deep into something that I know is a big passion of yours, and it's measurement-based care. And today we're going to be talking about it specifically from the client's perspective, which I'm very, very excited to talk about. My time here in EHN, this is a topic that comes up a lot, and every day I get to learn something new. So I'm glad we get to do it with the expert today.
Yeah, thank you. Um,
So I guess to kick things off, what is measurement-based care?
yeah, so that's a question I get asked a lot, as the measurement based care coordinator at Edgewood or at EHN, and I like to say, if someone breaks an arm, we go to the hospital, we get an X-ray. If someone has a heart attack, we go to the hospital. We can do like an EKG, or we can do blood tests, or we can do these different tests to try and figure out what's wrong and what we need to do to fix the problem. But how do we do that when it comes to someone's mental health? How do we measure? How do we measure for a broken arm when it comes to something inside, or whether it's addiction or just mental health as a whole? And so that's what measurement based care very much is. It's a systematic way of measuring what I'm going to call symptoms of addiction and symptoms of distress, to look at where a patient is, and then based on the results of those measures. So we use kind of standardized psychometric measures that are validated and very common across the industry. We use those measures to look at symptoms, and then based on those symptoms, we can adjust care plans to make sure that, one, the treatment is actually effective, and two, that we're giving these patients what they need in terms of treatment so that they can recover from whatever it is, whether it's trauma or anxiety, depression, mental health, or addictions. The full kind of spectrum of different mental health disorders, and make sure that we are giving them the best chance to succeed, and actual treatment that's actually going to be useful. That we're not just trying something, and if it's not working, we just keep doing it. We actually have the ability to look at what's happening, look at what's going on with the patient, and then make adjustments.
So walk me through that in a bit more depth. Like, are there specific assessments that you're taking throughout the journey? Are there different assessments? Let's say if somebody's struggling with maybe a substance use concern or disorder, or an anxiety or depressive disorder. Walk me through it.
Yeah. So our clinical team has a standard kind of battery of assessments that we use, and they measure for a whole host of different things. There's a lot of different measures and instruments out there, and we kind of picked one based on what we thought made the most sense for our patients. But we use ones like the PHQ-9, which is the public health questionnaire, which looks at depression. We look at the GAD-7, which is the general anxiety, a general anxiety one. We look at the LDQ for substance dependence. We look at the OQ45 is a big one at EHN, which looks at functional distress and functional impairment. We look at like the PCL, which is very common for measuring post-traumatic stress and levels of post-traumatic stress. It's actually a screener. So if you are above a certain threshold, then that's an indication that you should be screened for post-traumatic health with a proper professional. So we look at some of these things that measure symptoms, right? Like I talked about, and then by looking at someone's symptom measure and symptoms level, and what in 12-step programs we talk about the unmanageability. So if we look at kind of how manageable are these symptoms, how much are these symptoms impacting the patient's day-to-day functioning, and then we can adjust our treatment plans. So if someone has very high levels of anxiety, then okay, we need to work on mindfulness. We need to work on grounding techniques. If somebody has really high levels of depression, we need to be talking about gratitude and shifting things there. Maybe we need to work with our medical team to look at antidepressants or different medications there, based on what those levels are over time. So there's a lot of different uses from kind of a counselor, therapist, psychometric use, but also from our medical team, and it allows those teams to kind of work together. And it never replaces a counselor's kind of gut or a therapist's kind of view of what's going on, but it's a tool to help try and give them more information. Um, and then a really cool thing about measurement based care is not only do we do these screeners, then the counselors review these results with their patients and use them as a therapeutic tool to kind of have discussions about, hey, look, like I noticed that you're doing really well when it comes to your cravings or your addiction, but your depression's still really high. Like let's dig into that, or hey, look at the progress you've made over the 3 months in treatment, or look how much better you're doing, and here you are telling me you feel like it's hopeless, but you're really not, and things like that. Those are actual examples of stories I've heard from counselors in the last few months, about kind of how they use that with their patients. And I think that's a really important part so that patients can actually see how they're progressing through treatment.
That's really interesting. So before measurement based care, you might have a situation where even after months and months of therapy, somebody is coming in and still describing a feeling of hopelessness. And then it's sort of like nebulous how a counselor, based on their experience and that patient, will sort of work together to overcome that. But here with measurement based care, in this specific example, somebody could be coming in describing that feeling, which is still really important. But we can also look at measuring the actual LDQ or depressive symptoms over time and say, okay, we're still feeling hopeless. That's really important. But we're actually seeing that these other things are improving. Let's talk about that, see the success there, and see what we can learn.
Exactly. Another really good example comes from a counselor at Edgewood who we do a measure around readiness for change, right? And I'm sure you've heard like the different stages of change and some of that kind of psychology work. And so the counselor sat down with their patient and did this measure again, right? They'd done it at intake, and then they did it again, and they said, look, when you first came here, you were not very ready, right? You were kind of contemplating maybe being ready for change, and now you're in that action stage. So even though you're not necessarily feeling like you've come a long way, look at how this has shifted for you and the work that you're willing to do to actually get better. And that was when it came to addiction, right? So these are just some of the ways that counselors are using measurement based care at EHN.
That's really interesting. So, when I was in school, not to become a psychologist, but to become a youth counselor, one of the big things that came up all the time in university was this idea of evidence based care, which is like, okay, there's been years and years of research on cognitive behavioral therapy or CBT or DBT, all of the acronyms. And as a result, a psychologist or a counselor can look at those and say, okay, based on that, we know that that's an effective treatment for an anxiety disorder. Let's use CBT. How is measurement based care a step forward from what we know with evidence based care?
So I think that's a really great way to talk about evidence based care, and I think measurement based care just takes it kind of one more step. So, like when we talk about CBT or DBT, some of these kind of treatments are more effective at treating one thing than another, and there might be multiple different treatments that are effective at treating one specific symptom or one specific thing. And so as a therapist, I have to I have to work with what I'm comfortable with and know that this is what I see as effective. but two, I need to look at my patient and see, okay, what do I think is the most effective treatment for them? Because one person may respond really well to CBT, but someone else maybe needs more DBT skills or something that's slightly different. And so measurement based care can kind of give us glimpses into what's working and what isn't so that we can adjust those treatments as needed. Right. We do a lot of kind of EMDR or ART at EHN. And so maybe it's like, okay, we do an EMDR session and we see a big relief, right? But those levels are still pretty high. So maybe we need to build in an extra EMDR session into this treatment, or maybe we need to build in an extra one-on-one kind of CPT trauma counseling session into this patient's treatment plan, so that we can get them back to a better level of symptoms and have less distress.
It's interesting, and I know like in the mental health care world, there's kind of this ideal of like one size does not fit all, and this idea of customized care. And I think that this is sort of that next step to getting to that place where you're now actually able to say, okay, cool. Evidence says we should start here with EMDR. And we're seeing that it's successful for some pieces of it, but not actually everything. So let's also tune and add these different pieces to more appropriately treat this specific patient's concerns, symptoms.
Exactly. This is about providing counselors and patients with more, hopefully, kind of real time and more consistent feedback when it comes to creating and adjusting those personalized care plans. So it's not just, okay, at the beginning, we do an assessment. This is the plan we're going to lay out. And often that's kind of historically what happened. This is what we choose to do. And then we would work through that plan and then see whether it was effective when we came out the other side. Now, because we've kind of inserted these data collection points throughout treatment at a consistent rate, we can make adjustments as needed. You know, one of the big things about EHN and addiction recovery is it's not just about their time in inpatient, right? It's not just about their time in treatment, because that may be 50 days or 60 days or whatever it is. But then it's about, okay, now this person's going to go back home. And now, how do we match them up with the right level of care when they finish being with us, whether it's, a virtual intensive outpatient through our team, whether it's aftercare one-on-one counseling through our outpatient team, or whether they have, supports back home, whether they have a counselor, whether they have some of these supports back home, what kind of supports do they need in their lives to be successful after they're reintegrating back into their day to day? And what do we need that to look like? Because that is different for every person. So that the we're using measurement based care now to kind of help with that post treatment care planning and make sure that they have the right supports in place for when they get home to give them their best chance at successful long term sustained recovery.
And now actually being able to measure long-term sustained recovery. That's
Yeah.
really interesting.
And share this information with their care teams back home, right? Hey, look, they came in with very high levels of anxiety or very high levels of post-traumatic stress, and we did this screening and we did this work, and now they're here, right? And so this is the baseline of where they are. So they hopefully those care teams back home can do some of this work and see, okay, look, yes, the patient's getting better or they aren't.
So that really, really interesting. So walk me through what this looks like on a day to day for somebody walking in the doors at Edgewood and IMO or Bellwood Toronto. What is a patient or a client's first experience with measurement based care, and what does it look like throughout treatment?
So our inpatient and outpatient kind of processes are very different. And the reason for that is because when you're an inpatient, you're there, you're physically on site, and we have you for more time. So we screen for more things. So if a patient were to come into Edgewood or Bellwood and for their first week for, like, let's say, a substance use disorder program, in the first week we would have them do an assessment. We don't do it on the first day because we want them to get grounded. Sometimes patients need detoxing, different things like that. So they come in sometime over that first week, we sit them down, we hand them a tablet, and we say, okay, we everything's preloaded. and they go through and they do these standardized assessments, right? Like I said, we screen for anxiety, depression, dependence, levels of post-traumatic stress. We look at other screenings like compulsive sexual behavior, gambling addiction, eating disorders, things like that, so that if the patient flags for those things, then we know, okay, we need to add them into an eating disorder group. We need to sit them down with a dietitian, or we need to put them into an SLA group, or things like that, right? So we can kind of adjust those treatment plans early based on those screeners. And then, they'll get into treatment. They'll start doing their work. A few weeks later, we follow up with another session. This one is much shorter. So that first kind of assessment is about an hour, and it's all done on the tablet. And like I said, there's some measurement stuff. There's some program evaluation stuff in there for our own kind of research, and ensuring that it's working. And then there's those screeners, right? So, for example, we screen at all of our facilities because maybe we need to hire additional, maybe we need to hire additional counselors who have training in sex addiction, or who have training in eating disorders, or things like that. So there are other things that we look for from our own perspective on top of just the measurement based care stuff. And then a couple weeks later, they get again as a group with whoever they came in with that week. They'll sit down. They'll be handed a tablet. They'll go through another set of measures. These measures, again, these are the more measurement based care ones. They take about 20 minutes, right? And those are just screening at those symptoms. And then we can see, okay, this is where they were at baseline. Hopefully there's been some decline. Sometimes there isn't. Sometimes there's an increase, right? Whatever it is. And then we look at that. And then so we use a technology called GreenSpace to do this. And everything is automated. So as soon as the patient fills out those reports, everything's automated. Everything is done really well visually. It's graphed out. It's displayed in a way that's really easy for the counselors to kind of interpret it. Color coded, it's great. And so then the counselors can look at that. They know, okay, like at Edgewood, we do our surveys on Sunday nights and Thursday nights. So as a counselor, I know, okay, Monday and Friday, I'm going to look at my results and see my caseload and see if there's any changes, right? And then I can bring that to case conferencing. So then as a counselor, I bring that into case conferencing. I have a discussion with my team about it. Hey, look, they're doing better here. This is great. Or, oh, hey, look, they're not doing better here. What should I be doing to do that? And then they give that feedback to the patient. They sit down, they go through those results, they talk about it, and then again, they continue on with treatment. Right? Nothing really changes. A couple weeks later, boom, we go back again, and they redo that same assessment, that 20-minute assessment that they did a few weeks before. We get that data again, very similar process. Bring it up in case conferencing, review it as a counselor, review it with the patient, talk about the changes. And that's when we start looking at post-treatment care, right? Okay, what do we need to be doing? Do we need to be organizing funding? At Edgewood, we have this extended program. Do patients need to be going down to extended? Should they be looking at more intensive outpatient stuff when they get out of treatment, whether it's via virtual intensive outpatient with us or with someone else, or just aftercare with one-on-one counseling? Like, we start trying to figure out what that looks like. And then boom, a couple weeks later, we do a completion survey, which is very much looking at, okay, what's the big group of change that we use to forward to their post-treatment providers. But that's also where we do some of those kind of evaluation things that I talked about. And that one takes about 45 minutes, and then boom, they're done. So it's a very small part, maybe 2.5, 3 hours over the course of, say, 50, 60 days in treatment. It's a very small part of the treatment, but it can hopefully be very impactful in terms of the outcomes if we make the right adjustments.
Interesting. And so, do clients typically understand this? Do they understand how that feedback, how that measurement is being used in shaping their care, or is it kind of just a part of the system, so to speak?
A bit of both. So traditionally, we've been doing this for about 5 years at Edgewood and at EHN, and we never really used it purely for program evaluation. So the patients would do it, and it would be for our internal use in terms of, what kind of training do staff need, what kind of programs do we need to look at, what kind of therapies, like, do we need more CBT training, do we need more EMD, whatever that sort of thing is. So patients kind of had an understanding that this was something that they did. But The feedback piece is something that's a bit newer, and a feedback thing is something that we've rolled out this year, where they're actually going through it with patients. Um, we do talk about it with them. We include some language in their admission. We do proper consent, things like that, where we try to have a discussion with the patients around those things. Um, but that's something where it's a process of continuing education, right? So they maybe don't understand it at first, and then once they've been through kind of the system, or once they've kind of been through it and seen how it works, they have a bit of a better understanding of what it's used for. At the beginning, like I said, we try to explain it, but patients coming in, like I said, they're detoxing. Their cognitive abilities are maybe all over the place, and so I think that by the time they finish treatment, they have a very good understanding of what we're using it for. But it takes some time for them to get there.
And it's really interesting. And I guess like sort of two pieces here. One is on the client side. How do you like? I guess when you're bringing in this new program, let's say EHN opens up a new facility, we're training the clinicians on measurement based care. What sort of advice do you give to those clinicians to empower clients with measurement based care as opposed to making them feel like they're being measured as
Well,
such?
I mean, I think they are being measured, right? So that's one thing, but um, I think it's about talking to them and being like, "Hey, this is helpful for me when it comes to helping you, right? And this is one of the ways that you can give me feedback, and that you can let me know how you're doing, right? This is a measure so that I can see, what do we need to do in order to best treat you, right? Often when they're in treatment, they want to be successful, right? They want to get better, and so it's about that kind of real time feedback. I had I when we rolled this out at Edgewood, I went in and I spoke to the patients, and I kind of did a lecture around addiction research and talked about, you know, this is kind of what we use this for, and this is how this works, and this is what you should expect. And a patient put up her hand and said, I've just been kind of clicking the boxes and not paying attention to what answers I was given, because I didn't think this mattered, and now I understand. Now I see the value in this, and I'll take it more seriously. You know, and there was an adjustment there with our scores, and patients they were taking this much more seriously, and they did understand the value of it, right? They understand how this is about helping them maximize their chances of success. And I think if we communicate it that way, um, I've found that to be effective.
That's awesome. And I think too, like if you look at the history of psychology, really the only way you're getting feedback is if as a clinician, is if your client says to you, hey, this thing worked or feels good or doesn't feel good. Often patients like you might have had a client for a year and then they like might find another therapist and you don't know if it worked or didn't work. With this, you can actually see if something is working, adjust, and as a clinician, take that feedback and make steps. Like it could be that you're a seasoned clinician um, who might like need to take some time to adjust their work and like learn some new tricks. It could be that you're a new clinician who just graduated school and there's lots to learn. That feedback is really powerful and allows you to become a better clinician.
Yeah, and speaking of that, we use two measures. We use a therapeutic alliance measure, where the we do those at the midpoints and at the end, where the patients can give feedback around, do we feel like they're on the same page as their counselors? Do they have the same goals? Are the counselors looking out for my best interest? Things like that, right? And that's not used as a performance metrics for counselors, but you're right. It is used as a kind of self-reflection, because if I'm seeing, oh, none of my patients think that we're on the same page, then maybe I need to look at how I'm communicating things, right? Or maybe I need to look at, am I pushing my agenda versus their own, right? And am I listening, and things like that. So that's a really useful tool that we use. And the other one that we use as part of our kind of completion survey is a perception of care. So overall, how did they feel they were treated? What were the wait times like? Was the facility clean? Were they on the same path? Were their cultural needs respected, all sorts of things like that. And that allows us to kind of look at that information on a facility level and make sure that the facility is working its best as well. So we have two measures built in: one around the therapeutic alliance with the primary clinician, and one around the facility level thing to make sure that we are kind of adjusting as we need to make sure that we're effective.
That's awesome. So, lastly, like what are you most excited for, like with this sort of new emerging technology? What do you see in the next sort of 5 years with this being now a thing, almost
Yeah.
officially?
Well, I think there's two pieces. One, in the past, we've been collecting this data in inpatient treatment, but we've really struggled to collect this data with outpatient. And so, with this new technology, we've built it into Wagon, which is our kind of outpatient app, and we can start collecting that data in outpatient. So hopefully, we'll be collecting that data um, in aftercare and as patients leave. So we'll be able to track them for up to a year post treatment so that we can see the long term effects of our treatment, not just when they're in our care. And then the other piece that I'm really excited for is potentially taking some of that data, anonymizing it, and looking at for predictors, right? And so and then whether it's through logistical regression or AI, kind of feeding some of that mega data in a few years when we have thousands and thousands of data points in to look at predictors and look at, okay, how do we kind of one improve, but how do we best set up our people so that when I have a patient who had this similar level of symptoms and they did this and it worked, or they did that and it didn't. So what are we going to do differently, or what are we going to do the same? And use that for that kind of care planning, because I understand that like every patient is unique. However, we see patterns, right? We see at EHN, we see multiple thousands of patients a year. And so we can look at patterns, we can establish patterns and see what works and what doesn't based on that kind of volume. I mean, we're one of the largest treatment providers of mental health and addictions in Canada. And the fact that we will now have this information will help us kind of really fine tune those treatment plans as we move forward. So those are the two things that I'm really looking forward to.
Jeff, this was fantastic. Thank you so much. Every time I talk to you, I feel like I learn lots and lots more. I feel like I know everything at the end, but then there's always more. So
Yeah.
thank you so much.
Thanks,
Uh,
Jonathan.
my pleasure. So, if anybody um, is curious to learn more about measurement based care, go to ehncanada.com, go to our blog, check out more podcasts. This is a topic we're going to be talking about more and more over the coming weeks. And you can access and learn more about our treatment programs there as well. And to listen to even more episodes of Five Facts, you can find it on your favorite streaming platform. Jeff, thanks, and we'll see you all next time.